Hello everyone, this is Yadira Valdez, and my article is titled Beyond Silence, a randomized parallel group trial exploring the impact of workplace mental health literacy training with healthcare employees. A little bit of the background. Mental health in the workplace is a growing concern for many employers, with significant financial and human costs associated with mental health problems. Unfortunately, many healthcare workers experience pressure that can detract from their psychological health and well-being. The emotionally demanding nature of healthcare work, heavy workloads, as well as limited time and resources can take an emotional toll and lead to higher rates of absenteeism and presenteeism when compared to workers in other sectors. Furthermore, the stigma associated with mental health problems can lead to delays between the onset of symptoms and receiving treatment. Issues may be ignored or overlooked due to the lack of understanding regarding mental health disorders and their treatment, as well as stigma associated with seeking help. Background continued. Education in the form of mental health literacy training can help to build the knowledge and beliefs required to recognize, manage, and prevent employee mental health problems. The Beyond Silence program was developed by the primary author of this article to address the unique educational and support needed of healthcare workers. Curriculum design was informed by the findings of several qualitative studies with healthcare workers as review of their workplace programs and best practice principles of contact-based education and adult education. It includes examples and resources that are customized for healthcare organizations. The contact-based education approach was devised on the premise that positive voluntary contact over time with a person who has a stigmatized condition is the most effective way to reduce stigma and discrimination. As such, the programs are co-led by peer educators, healthcare workers who have personally experienced with mental health or addictions issues, and are trained to deliver the program. Education in the form of mental health literacy training can help to develop the knowledge and beliefs required to recognize, manage, and prevent employee mental health problems. One of the most commonly cited and well-known mental health education programs is Mental Health First Aid, or MHFA. It is a standardized module-based program designed to teach participants how to recognize the early warning signs of common mental illnesses, how to provide initial help to someone in a mental health crisis, and how to support people who are developing mental health problems. The program was developed to educate the general public and has been implemented in a range of settings around the world. There is a growing evidence-based support in its effectiveness in increasing mental health literacy. The purpose of the study. The purpose of this study was to compare the impacts of a customized contact-based education approach, which is Beyond Silence, with the standard mental health literacy training of MHFA on the help-seeking, help outreach behavior of healthcare employees. Objective. This study sought to evaluate whether a contact-based workplace education program was more effective than standard mental health literacy training in promoting early intervention and support for healthcare employees with mental health issues. Let's look at the methods. So the methods included a parallel group. It's a randomized trial was conducted with employees in 2 multi-site Ontario hospitals, with the evaluators blinded to the groups. Participants were randomly assigned to one of 2 groups. Group-based education programs, which is Beyond the Silence, comprising of 6 in-person, 2-hour sessions plus 5 online sessions, co-led by employees who personally experience mental health issues. Or Mental Health First Aid, a standardized 2-day training program led by a trained facilitator. Participants completed baseline, post-group, and a 3-month follow-up survey to explore perceived changes in the mental health knowledge, stigmatized beliefs, and help-seeking, help outreach behaviors. And intent to treat analysis was completed with 192 participants. They initially started with 230. Just to say, and it was randomized to 192. 38 were excluded because 4 did not meet the inclusion criteria, 10 declined participation, and 24 did not complete baseline data. And the way the groups were divided was Beyond Silence had 97 allocated to the intervention, and Mental Health First Aid had 95 participants allocated to the interventions. And differences were assessed using multi-level mixed modules, accounting for site, group, and repeated measurement. Now let's look at the results quickly. Neither program led to significant increases in help-seeking or help outreach behaviors, which concluded that both programs increased mental health literacy. They both improved attitudes towards seeking treatment, and they both decreased stigmatized beliefs, with sustained changes in stigmatized beliefs more prominent in the Beyond Silence group. Conclusion. Beyond Silence, a new contact-based education program customized for healthcare workers, was not superior to the standard mental health literacy training in improving mental health, help-seeking, or help outreach behaviors in the workplace. The only difference was a reduction in stigmatized beliefs over time. Additional research is needed to explore the factors that led to behavior change. So the study findings did not reveal, again, any significant changes in the behavior related to either help-seeking or help outreach. This finding was disappointing because behavior change was one of the primary goals of the educational programs. There are several potential reasons for what appears to be a limited transfer between changes in knowledge and attitudes to changes in behavior. So the study findings did illustrate that both the MHFA and the Beyond Silence programs were effective in enhancing perceived knowledge about mental health issues, reducing stigmatization, and improving attitudes towards seeking help. The positive impact of MHFA on these outcomes has been reported in many studies and literature, including some workplace-based studies. Although the Beyond Silence program was not superior to MHFA training, this is the first study to illustrate similar outcomes in 2 different workplace mental health education programs. Furthermore, the findings suggest a possible added value of Beyond Silence, a contact-based educational program in sustaining reductions in stigmatized beliefs. It is an important finding since stigma is one of the key barriers preventing healthcare workers from seeking mental health treatments for themselves or reaching out to provide help to others. Because healthcare workers may already have a strong baseline knowledge about mental health, a sustained change in attitudes or beliefs may be the key to overcoming barriers to early intervention and support. Their study findings were consistent with reports in the literature regarding the immediate impact of mental health literacy training, including MHFA, on stigmatized beliefs. However, it is critical to explore strategies that will sustain these changes over time. A longer-term follow-up is needed to investigate such changes over time. It is important to note that the sustained impact of the contact-based approach in the Beyond Silence program was further supported by qualitative data regarding program implementation. So let's look a little bit at about the strengths and limitations that this study demonstrated. So one of the strengths of this study was that the randomization process reduced the risk of bias when comparing the outcomes of the two programs. In addition, the follow-up period facilitated our understanding of whether changes were sustained over time. Now, regarding to limitations, a limitation of the study is that it was conducted with hospital employees in one geographic region of Ontario. Participants in the studies were volunteers, so this is a good thing. So they may be more open and receptive to the educational program. Furthermore, further research is needed to engage a higher percentage of male employees, non-clinical staff, and individuals who may not be as receptive to the education provided. And this is another factor in the research is, in addition, research is needed to explore whether the findings are replicated in smaller organizations, in rural settings, in other jurisdictions. This is my reference, and thank you for listening.